I definitely was very excited. Being able to get into medical school was a dream of mine for quite some time. I've always been most interested in ENT, which stands for ear, nose, throat, and I found myself so intrigued by the anatomy of the head and neck.
Becoming a doctor has changed my life. I think one of the most exciting and pivotal moments was in my third year of medical school, where I first entered the wards and started my clinical posting. I remember not just anxiety, but really excitement talking to my first patient and really honing my clinical skills and clinical judgment. When I got that opportunity to do it, it was really exhilarating.
There was an incredible elegance about medical science and seeing how everything came together in the diagnosis and treatment. I put that as my first choice, and I've no regrets ever since.
I like biology a great deal, and it seemed quite natural for me to go into medicine. As a student, I was very interested in public health. We had a community medicine program where we went out into the rural parts of Singapore. So if somebody is very interested in medicine, I would say you have to be interested in people. You must want to go out in service of the population. That motivation is very critical.
I remember my grandfather had cancer and he was suffering, but I always remember the healthcare workers who really cared for him, and that really inspired me. And I thought that I would be able to take on that role and help other people in their time of need as well.
The NUS Medicine School of Medicine is a truly Singaporean medical school. It trained most of the doctors serving in Singapore. And as such, the school has a huge alumni of over 12,000 doctors.
Medical schools like the NUS School of Medicine, they are one of the key pillars of our healthcare system. Because the healthcare system revolves around the talent we have and the healthcare professionals. So medical schools that produce our doctors actually keep the entire system alive.
In 1905, one man recognized the dire need to provide proper medical care for local people and petitioned the British government to take action.
In those days, the colonial governor said, we don't have the money. But I think our local businessmen said, no, don't worry, we'll help you to build a school. And they did.
The school was founded by Mr. Tan Jiak Kim and other Singaporeans who got together, raised the funds to create a school which could produce doctors for Singapore's needs. And I think that's something we always have to remember. We were created by Singaporeans to help the people of Singapore.
Gathering more than $87,000 to start the school, the efforts of Tan Jiak Kim and other merchants marked a milestone in Singapore's history. On July 3, 1905, the Straits Settlements and Federated Malay States Government Medical School opened its doors with just 23 students. In 1921, the school was renamed the King Edward VII College of Medicine after the British monarch. As the school grew, it attracted more students from across the region and laid the groundwork for medical research and public health initiatives. In 1949, the school merged with Raffles College to form the University of Malaya. This laid the foundation for what would eventually become the National University of Singapore.
The College of Medicine building is very imposing with its pillars. One gets awed by that building. And then just behind was the Tan Teck Guan building, which was where we did our dissection of cadavers. When you entered the dissection hall, the formalin would literally hit you in the face. And quite a few people fainted in the early days. But again, I took it in my stride. We didn't have access to things like Google, and we didn't have mobile phones. So everybody interacted with each other.
Doctors had to rely on their sixth senses to help patients. From what you can gather with your bare hands, your ears, and your eyes. So in that sense, the quality of care may not be as good as what it is today, but no less effective.
And as the school evolved, so did its student population. In 1911, only 2 women graduated as doctors. Today, 60% of the university's medical students are female. Over the years, Singapore's health system gradually advanced to address new challenges. In the 1950s, breakthroughs in infectious disease control, particularly in treating tuberculosis and malaria, saved thousands of lives. As the population grew, so did its medical needs. By the 1980s, the medical school marked a new era by moving to Kentridge.
Singapore's growth from third to first world country parallel the growth of the university. I think without the university, you can't even talk about first world Singapore. No way, no way. But main thing to remember is that this is all due to hard work. This is how Singapore survives and will succeed in the future.
So when I became dean in 1997, I and my colleagues worked on reforming the medical curriculum. The first is we changed from studying each subject separately to studying about systems. So we study the cardiovascular system, which is about the heart, the blood vessels. We study neuroscience, which is how the brain, the nerves, how they function, both in health and disease. The second important thing was to move to problem-based learning. So for example, somebody who is obese, as a medical student, we needed using problem-based learning to understand if you're obese, what are the issues that could entail. And the final thing that we did was to introduce clinical exposure much earlier so that they can start to develop the instincts, the empathy, the ability to relate to patients.
As the school approached its 100th year, an unexpected turn of events gave the school a boost.
I was privileged to be looking after Chief Justice Yong Peng Hao, and I shared that we didn't have enough resources to recruit all the people that we needed. And so Chief Justice Yong very kindly, he must have spoken to the Yong Lu Lin Trust. Around 1996, the Yong Lu Lin Professorship in Medical Oncology was created with a substantial donation from the Yong Lu Lin Trust.
In 2005, the Yong Lu Lin Trust would bestow upon the school a gift of $100 million.
It was at that time the single biggest donation given by a family to any institution of higher learning in Singapore. It transformed the medical school. It was probably one of the single biggest factors that transformed us from a great teaching school to a great teaching, research-intensive medical school.
Another significant milestone was the Lee Foundation's gift of $30 million to start the Alice Lee Center for Nursing Studies in 2005.
Nurses are important because we form the largest work group within the healthcare workforce. Over the years, the role of nurses has evolved from a supportive role to one that is collaborative and complementary to doctors. Today's nurses are also educators, advocates, researchers, and leaders who play a vital role in shaping patient care and healthcare policy.
Over the years, the school began looking for more ways to build on its strengths and to collaborate with other disciplines.
One of the major issues that emerged over time was that there was no real integration between the medical school's vision and programs of the hospital. Around 2007, a number of us made the case to the Ministry of Health that we should create a new entity, which eventually was called National University Health System.
NUHS is Singapore's academic health system comprising acute and community hospitals. NUH is really the nation's first university hospital where clinicians, students and researchers come together to engender advancement in teaching, research and the practice of medicine.
The school has this mission to create solutions for the health and healthcare challenges that Singapore faces. And the only way to create solutions is through research. We cannot just be constantly using existing knowledge to treat our patients.
The research that is being done in the university is quite mind-boggling. The research in longevity and the life sciences, it completely takes my breath away.
Research makes for better healthcare. Medicine is transforming every day with new hypotheses, new discoveries, advances in technical capabilities. All these present new opportunities for improved treatments and to make care safer, more cost-effective, more accessible for the benefit of our patients.
Today, the school has established 10 translational research programs and 15 faculty research centers across several different fields, including healthy longevity, human potential, Asian women's health, digital medicine, and behavioral and implementation science interventions. Among these was a bold new initiative to transform clinical practices and healthcare.
We are also interested in not just human conditions, but things that are happening to the planet. So what we do at the Center for Sustainable Medicine is to address the practice of medicine itself. It's not a well-known fact that the healthcare industry is the 5th largest polluter and produces more carbon dioxide than the aviation and the shipping industry combined. Everything is now single-use disposables.
In the process of us delivering care and trying to save patients, we are doing the opposite to the planet, to accelerate the adoption of net zero healthcare. I think it's a very ambitious target. The Center for Sustainable Medicine is probably the largest in the world that is singularly focused on reducing carbon emissions related to healthcare.
In the last 5 years, we've moved beyond medicine. So right now, the challenge I've been issuing to our faculty members and our students is that instead of just treating disease, can we optimize health? And I think that's a very important thing to do.
The important message here is lifelong learning. Evolve with time and evolve with the situations and learn to adapt, because we cannot predict in 10 years' time how things will be like, because technology is changing at a phenomenal speed.
And that is one of the most wonderful things about medicine. It never stops or stagnates. And I remember an analogy from a senior doctor a long time ago. He said, every generation is like Russian dolls. We can either build it bigger or we can build it smaller. And I think there is a very strong culture within NUS and NUHS that we build the next generation bigger than what we were.
I'm very grateful for all the mentors that we had throughout medical school, and I think they really shaped our journey and shaped the doctors that we are today. They often take the time out to teach us as medical students, impart their knowledge and wisdom to us, and allow us to grow alongside them.
To the young doctors, our future leaders out there, there's one word I can share with you, is dedication. If you take up medicines as your career, you dedicate this to yourself and to the people that you need to take care of. And it's your dedications towards them to make sure that you do the best for them.
Our school has made very important contributions to Singapore in the last 120 years, and I'm confident we will continue to do so over the next 100.
We are no longer just trying to be best in Singapore or best in Asia. We are now competing with the very best in the world.
Every year, we are able to attract some of the best and brightest to NUS Medical School. I hope that they will continue to innovate in their teaching of medicine, to be at the forefront, not just in Singapore, but also in the world. And most importantly, I hope that they will bring up people who will impact society in Singapore and beyond.
From its early beginnings 120 years ago, as a humble school to train local doctors for the community, to becoming one of the world's leading medical schools, it has been a truly remarkable and rewarding journey.